Good afternoon, everyone. My name is Nancy Scott. I'm sitting in for Dr. Kathy Nickham, the Education Director of the Dialysis Patient Citizens Education Center. Today we will have a webinar by the CEO of Patient Citizens, Hrant Jamgochian. And I have a lot to say. Just bear with me. I'll be very brief, but I do have a lot to say because he's done a lot of things. So I'll start off by saying Hrant joined DPC in April 2011 and has served as the CEO since. In this capacity, Hrant directs and oversees all day-to-day operations of the organization, including coordinating board of director activities, fundraising, public relations, and lobbying. During his tenure, Hrant doubled DPC's membership to over 30,000 plus dialysis patients and family members working to improve patient quality of life, dramatically increased its social media and online engagement, significantly expanded fundraising efforts and corporate sponsorship support, and launched the affiliate 501c3 organization, DPC Education Center, to expand ongoing patient education efforts. As the primary spokesperson for the organization and lead advocate for DPC, Hrant spearheaded numerous successful advocacy efforts securing passage of legislation to provide dialysis patients with access to Medicare Advantage, the first disease-specific accountable care organization, known as ACO, initiated by the Center for Medicare and Medicaid Innovations, that's CMMI, currently called ESRD, Seamless Care Organizations, that's ESCOs, a 2-year delay to dialysis funding cuts at the federal level, which was followed by another 3-year adjustment to reimbursements to help stabilize the system. Medicare secondary payer, that's known as MSP, protections for dialysis patients in the health insurance exchanges, guidance from the administrator that ensures patients will retain their access to premium tax credits and subsidies even after they are diagnosed with kidney failure. Removal of prior authorization requirements for dialysis patients with medication coverage in Medicare Part D, and legislative and regulatories in more than 24 states. Hrant also successfully sued the federal government to protect patient access to charitable premium assistance as the lead plaintiff in DPC versus Burwell. He has since been involved in additional litigation to protect dialysis patients' access to care. Formerly the Director of Health Policy for United Way Worldwide, Hrant brings extensive expertise in formulating and advancing effective health care policies at the national and state levels. Hrant previously served as Director of Congressional and State Relations for the American Pharmacists Association and as Director of Field and State Operations for the American Psychological Association, where he spearheaded a number of successful national advocacy initiatives and grassroots campaigns. Hrant received his Juris Doctorate, that means he's a lawyer, and from Catholic University Columbus School of Law, as well as his Master of Law in Global Health Law from the Georgetown University Law Center. Well, I have to say a little something that that wasn't given to me, and that is, you can see he hasn't done much. But on the real side, he's a great person. He's a triple threat. He's a leader. He's a CEO, and he is an attorney, which is such it's just a great advantage for dialysis patient citizens. And without further ado, I'd like to introduce the CEO, my friend, Hrant Jamgochian.
Well, Nancy, thank you for that warm introduction. I'm not sure how I can follow up. I'm going to have to, take you everywhere I go and, let you know the check is in the mail. I appreciate it. So on that note, For all the accolades that, Nancy, highlighted during my tenure at DPC, I've just been truly fortunate to work for an organization that's led by ESRD patients, like Nancy. Our entire board, both at DPC and at the DPC Education Center, consists entirely of dialysis and transplant patients. And, they've been driving our focus, both for elevating the patient voice of policymakers, but also for the work that we do to further empower patients with their, own care. And so I was pleased to be invited to speak on this month's topic, which is the title, obviously, was Medigap and Is It For You? But it probably should have been, have you seen the commercials with J.J. Walker that talk about how Medicare is dynamite? And have you talked to your social worker or someone else at your facility about, an annual health care checkup and or health insurance checkup, and is the insurance that you have now the right fit for you? And so really I've kind of broken this presentation into 4 parts. The first, I briefly want to kind of cover some of the main types of insurance so we can level set, because I've heard far too often from patients, I'm not really sure what kind of insurance I have. But then also, if you are thinking about, whether your insurance, works for you, some things that you may want to consider. As you've heard some of the commercials on TV about additional benefits and other things, I want to, run through some of those that you should also talk about, whether with a navigator or whether with, your social worker at your facility. But I think probably what I may also highlight today too, and what I'm potentially most proud of, is the work that DPC, that all the patient advocates that I work with have been doing, to help increase patient access and affordability for Medigap coverage, which will be the 3rd section about ongoing advocacy. But I also want to make sure that, I leave time at the end to answer your questions. I'm certain that I'm not going to be able to get to each and every issue, and I think it's important to remember that everyone's situation is different. Everyone has different health conditions, different medications, different issues, and that's why really what this is about is making sure that you're aware that within a week open enrollment for Medicare ends, but in that time frame over the next few days that you take some time to ask at your facility about your coverage, and are there supplementary or other plans that you should consider. And so with that, I'm going to first start to talk about the types of insurance or some of the different options. And some of the options are private coverage options. Most Americans get their health insurance through their employer or employer-sponsored plans. Of course, that number is shrinking. More individuals are now getting insurance through either state or federal exchanges. That's a marketplace where patients can go and purchase their coverage online. That also open enrollment period is now too. There are also individual plans that are available for people to purchase. But, as many of you know, oftentimes, whether due to kidney failure or other issues or health-related, sometimes individuals aren't able to continue in their current employment or need to change. And so there's COBRA or continuation of coverage for smaller employers that will allow individuals to carry their insurance coverage, in the interim until they find an alternate plan. And for those who may have missed enrollment periods, there are short-term plans that may be available too. But the one that we may end up highlighting the most on this call, definitely the second F is some of the Medigap options, because when it comes to public coverage, most dialysis patients are currently enrolled in Medicare fee-for-service, that only covers 80% of healthcare expenses, and that leaves the patient with covering the 20%. And Medigap or supplemental coverage, it's a private option that's available for patients or may not be available, and we'll talk about that momentarily. But that's something that you should also discuss with the social worker at your facility. As far as the types of insurance, for each one of those, there are health maintenance organizations or managed care organizations, and with those kinds of plans, the idea is to offer maybe a more restrictive network, but you may also see, get additional benefits, get some additional dental coverage. They really focus on trying to keep the healthcare costs down and in exchange offer more preventive services or other benefits, but they restrict your network as a result. Another kind of managed care organization that's even more restrictive is a exclusive provider organization, but you may want to go the other direction if you want to go and see the doctor of your choice. A point of service plan may be another option. It does require a referral from your primary care doctor, but a preferred provider organization may be what you're most familiar with, and that's where you can go to whoever you want, and your insurance helps to cover those expenses. And that's often what a Medicare plan is you got to go to the plan that you choose. There are also high deductible plans, with or without a health savings account. So in other words, if you are often, this is really an appealing option for those who are younger and healthier and want to save some money and set aside funds. And there are other kinds of private insurance options, but these are just some of the most common ones. And before I confuse you more with all the different options, I do want to touch on some of the more public health insurance options that you may be more familiar with. And Medicare, so the traditional or fee-for-service, that's what about nearly 80% of dialysis patients are enrolled in, and that's the 80% is covered by Medicare of your care, and the 20% coinsurance is often what patients are billed for. So when you go to the hospital, if you get a bill for $50,000, the expectation will be that Medicare will cover 40, and you might get a balance bill for the remaining 10,000. However, and that's one of the reasons why the next option, Medicare Advantage, is becoming more and more popular nowadays, because Medicare Advantage it does a couple of things. One, it offers an out-of-pocket limit. So if you're an individual, next year that'll be a maximum of $8,700. So if you have a medical bill of $100,000, that 20% or $20,000, you can't get charged more than $8,700 in a year. And so that gives you some financial security versus being, having unlimited medical debts. At the same time, it does also provide you with additional treatment options too that may not be available in fee-for-service, such as transportation, additional nutritional supplements, or even dental or vision benefits. But you have to check because not every plan offers those, and that's one of the reasons why it's so important each year to look at what plans may be offered. Medicaid, also about 40% of dialysis patients are dual eligible, and so that means that while Medicare covers 80%, Medicaid helps to make up and covers the remaining 20%. However, many dialysis patients, even if they're on limited income, they may make too much to qualify for Medicaid. Depending on what state you're in, that could be a really, really low threshold. But for many, that safety net, many dialysis patients, is absolutely critical. So Medicaid, generally limits whatever out-of-pocket expenses you have, because it serves some of the most vulnerable, citizens. VA also available for veterans. I mentioned CHIP because I've met several advocates who may have enrolled because they may have given birth and lost their kidney function through labor, and that's generally for kids, but also mothers can enroll in that. There are high-risk pools in some states. So needless to say, there are a variety of different options out there, but generally, Medicare is the one that most dialysis patients ultimately, do end up in. And I think the most important thing, action item number 1, make sure you know what type of insurance you currently have. I was on a call a couple of months back, and I asked the patient, what kind of insurance he had, and he mentioned Aetna. And so that very well could have been a Medicare Advantage plan. That could have been a Medigap or supplementary plan, or it could have been something completely different. And so that's one of the most important things is for each and every one of you just to know what plans that you currently have. What type of insurance, what kind of protection do you have? And like I said, Medicare Open Enrollment, it ends December 7th, and I'm sure you're seeing all the commercials about all the things that are available if you enroll in Medicare Advantage. And I think, to a certain extent, depending on the plan, it may be appealing to consider, what options there are for Medicare Advantage. Are there additional dental benefits? So if you're considering potentially getting a transplant, and dental is a huge issue for you, that might be something to think about. But it probably starts with the first round of considerations is how's it going to impact your pocketbook? What are your out-of-pocket expenses? What are you responsible for? So in other words, is there a deductible? Now we talked about how Medicare has a 20% coinsurance, and as well as out-of-pocket maximums. Is there one? And in Medicare, there's not. However, there are supplementary or Medigap plans potentially, and the question is, can you purchase those? Because if you're under 65, in some states, you may have access, but it just may not be affordable. And that's why the next question is, how much does it cost? And if you don't have a Medigap plan, because when you first looked at it a couple of years ago, it just wasn't affordable, it may not be a bad idea to go ahead and ask, what are the plan rates now? Because in some states, some of those supplementary plans may have gone down, or if there are more plans being offered, more competition, or additional state protections that have been enacted. And so it's really important that you look at not only what do you have now, if it's only standard Medicare, if you want to change to Medicare Advantage because those other options are appealing, that may make sense. But I think the other thing too to look at is the provider network. So a lot of dialysis patients or ESRD patients may have a number of specialists that they may see, whether it's a transplant surgeon, an endocrinologist, nephrologist, and does that Medicare Advantage plan include those doctors in their network? In other words, I know my nephrologist, when I was looking at Medicare Advantage when it was available for the first time for dialysis patients last year, looked up, and he did not accept any of the 14 plans that were available, in my location. So, for a lot of patients, that's an important factor, is making sure they can continue with, who their healthcare professionals, experts are. Also, you may want to look at your current medications. Are they covered if you switch plans? So Medicare Advantage, they often have formularies. So in other words, they look at certain classes of medications, and they may require something called step therapy. So they will look at, what's the least expensive medication in that class? Does it work for you? Well, let's try it. It doesn't? Okay, fine. Then what's the next higher medication? And, you may have already gone through that process, and that may not be appealing. But one of the things that might offset some of those considerations is, do you need additional benefits? I was alluding to dental before. One of the biggest barriers for dialysis patients to get a transplant is, the requirement that, they pass dental examination, because any risk of infection could lead to rejection of a kidney. And, depending on if you need a root canal or other, expensive interventions, that could be a huge barrier for patients. But at the same time, just because the plan you chose now has those dental benefits, what happens if those benefits go away in subsequent years? And, that's something that you should definitely talk about with your social worker, because one of the challenges is if you do have a good supplementary plan. So let's say you've got a good Medigap plan that covers the 20% that Medicare doesn't cover. What a lot of patients don't realize is that if you shift over to Medicare Advantage, there is the opportunity to potentially shift back in a year. But if you shift later down the road, Medigap is able to go ahead and rate and consider your health status in the future. Well, in the private sector, private insurance coverage, a lot of you may remember with Obamacare, there was the ban on pre-existing conditions. Well, one of the challenges has been, I've heard from many patients, is that, even when they choose a Medigap plan that at the time, looked great, if they down the road want to change plans because there are less expensive plans, or because the other plans may have lower deductibles or other lower cost-sharing issues, well, then that other plan may be able to charge you higher premiums than what is published. And so that's why, it's really important to get a good handle on, all the potential trade-offs that may be available as you not only look into what you have now, what options are available, and if you decide to change back, what are the potential implications of doing so. And so the action item number 2. Number 1 was obviously it's important for you to know what kind of health coverage you have. And number 2, it's to find out what options are available to you. There's another week until December 7th, and talk to your social worker at your dialysis facility. They'll be able to talk to you about your options. They'll be able to, discuss your medical history and, talk about the medications that you take and what may or may not be, how that may or may not impact your access to different plans, and whether it might make sense for you to consider a Medigap policy if you haven't enrolled in one in the past. And I think the next section that I wanted to talk about is more of some of the ongoing advocacy efforts, and in particular about the Jack Reynolds Memorial Medigap Expansion Act. So some of you may know Jack was our former board president, one of the founding board members for Dialysis Patient Citizens, and he was on dialysis for over 45 years. And when we started talking about this issue, he actually brought up the fact that he was lucky enough to be in the hospital. Not too many people say that, but in his case, he mentioned that he was in the hospital for a knee issue almost 30 years earlier, and there was a special enrollment period that his social worker told him about that allowed him to sign up for a supplementary or Medigap plan. And so for over 30 years, he was able to, as he said, focus on his health, not worry about the finances or anything else, but focus on, following the instructions that his doctors, nurses, other healthcare professionals gave him. And he really wanted other patients to have that same financial stability. And so, when he passed, there were quite a few tributes about his advocacy efforts. And, his congresswoman wanted to do something in his memory. And, this legislation was already part of a bigger, kidney bill. And so she pulled it out and introduced it in his memory. And we got it introduced and supported ongoing efforts for it to be a bipartisan piece of legislation in the House. And the whole purpose is to require Medigap plans to offer coverage to all ESRD Medicare beneficiaries. And that's regardless of age, because if you're 65 or older, you can go ahead and purchase a Medigap plan. You know, it's not a problem. But if you're under 65, you're an ESRD patient, a lot of that depends, if you can believe it, on your geography. And so that's one of the reasons why, you know, Jack had been advocating so much on the Hill to try to get more financial security to help cover that 20% coinsurance, but also to increase dialysis patient access to transplant. While, you know, he was not eligible for a transplant, and I know there are a lot of dialysis patients who aren't as well, but most transplant centers want to ensure that you're able to pay for the 20% of the transplant surgery. So I've heard, you know, patients talk about in their states, they've been asked to set up an escrow account of, you know, upwards of $100,000 to cover that 20% to proceed. Or else they go from being an active member on the transplant list to being listed as inactive. So for so many patients, this is such a critical issue, not just the financial security for those under 65, but also increasing access to transplant, which is why, you know, we've made it a priority. And I mentioned geography. So one of the things you can see from this map, on our website, we created this interactive resource. So if you're under 65, you can go and look at how your state rates. And you can see the dark green refers to not just access, but affordability. Are there state protections available? To the red may be that, you know, it may be available, but there are, you know, not really any patient protections, so it's not affordable. To the dark red, where they not only have enacted legislation to provide access to Medicare eligible patients under 65, but in 4 states, they actually excluded dialysis patients. And so we're going back in those states to try to fix those efforts, as well as working at the federal level. And you can see this is the key that, you know, DPC created to help educate policymakers, because we also saw from states like Delaware that, you know, they require Medigap to be offered. That doesn't mean that it's affordable. So instead of paying a couple $100s a month, there are actually plans that you can purchase. Well, not necessarily many people can purchase in Delaware that instead of a couple hundred are actually a couple $1,000s a month. So one plan this past year, the annual premiums were $32,000 a year. And there just aren't too many patients who can afford those kinds of premiums. And so that's why that's a light red, because yes, there are plans that are offered and the state requires them to be offered, but, you know, do they have any patient protections that caps how much they can charge for them? And that's, I think, what the AMBs referred to. Are there protections that say you can't charge more than what you would charge a patient who's 65 years or older? Or maybe it's some kind of a weighted average, but something to make sure that's affordable. And as you can see from the previous map, while there's some green, there's a lot of work for us to do on the light red and pink all the way to the dark red. And so this patient education has been absolutely instrumental for engaging both state and federal lawmakers on the issue. But when you click on the individual map, I use Alabama as an example. You can go and click on your state, Delaware, whatever state you may want, and you can see an explanation of why that state got that grade. So in Alabama, it got a D because the state itself, it does not require any coverage for ESRD patients under age 65. At the same time, there are some insurers who are offering plans. And, you know, that's not as common, because when insurers offer plans, they don't necessarily want every patient who may be an expensive patient to go to their plan. And that's also why those plans are not affordable, because the premiums may be close to what the coinsurance costs may be. And that's why generally insurers, if they're going to offer plans, they'd like, you know, the same level playing field, that all insurers, you know, are required, or they're competing against one another. And, you know, as our constituents in the state educate state policymakers about the potential impact, you can see there's almost 14,000 patients in the state that have end-stage renal disease. And Right now, over 8,000 are on the wait list. And this fact sheet also scrolls down, and it highlights what state and federal protections there are, provides additional information. And so there are these online really great tools to help educate you about, not only the access to Medigap available in your state, but also the affordability. And, we'd love to get your support in helping to advance policies to improve access for patients. And that's why the second step, in addition to that map, recently we commissioned an actuarial analysis by Health Management Associates. So in other words, we wanted impartial data. It's one thing for us to go ahead and say patients deserve this coverage and it won't cost the government that much. It's another thing to have an actuary that goes back. It looked at 3 years worth of Medicare information, so 2017 through 2019, the most recent data information that's available. And they looked at, well, if you open up Medigap to those patients under 65, how much would it cost? And they came up with, over 10 years, it would cost $50 million to expand Medigap, which, for those of you who've been watching the news and have heard about not just billions but trillions of dollars in expenses, that's not much. But this legislation, the Jack Reynolds bill, also would extend patient access to private coverage, or what we call Medicare secondary payer protection. And it would extend it by 12 months. Currently, if you've got private coverage, you can keep your private coverage for 30 months. And then afterwards, your private generally becomes secondary and Medicare kicks in as your primary coverage. This would allow you to keep it for an extra 12 months, which may actually help smooth the transition for a transplant, versus shifting back and forth. But by doing that, it also saves the government over $1 billion. So the legislation that is being proposed to not only expand patient access to Medigap, but also allow patients to keep their private coverage longer, just by allowing an average of 2,000 patients out of nearly 500,000 patients with ESRD to keep their private coverage longer, that's over $1 billion in savings. And so by having this kind of data and taking it to Capitol Hill, it's really helped us generate a lot of momentum, on the issue. But what's most important, and what I always tell policymakers or tell people my job is to remind policymakers that there are real people behind these numbers. Whether it's Nancy, whether, it's Blessy, whether it's other patients who are on this webinar who are going to be impacted by that legislation. And you can see this actuarial firm, they took our scorecard and they broke out, and you can see they took out the individuals who were already enrolled as a dual eligible in Medicaid. And so for those patients under 65, there are over 100,000 Americans who would potentially benefit from passage of this legislation, not only to increase access, but to make it affordable so that patients can go to sleep at night without worrying about, what medical bills they're going to get, from the doctor's office or the hospital. Or more importantly, that will allow them to stay on the transplant list and not have their name moved from the active to the inactive list. And, I think the other thing that they really helped us with is when we were testifying about increasing access to Medigap in state legislatures this past year, insurance companies would say, oh, it's going to drive up premiums by double digits. We can't make Medigap more expensive for Americans. And, they looked at the analysis in those states that were A's. There's not going to be any change in premium to anyone else. If you're in a state with a B, that means you have some plans available. This is a really conservative estimate, and they put it on the high end. They said of 0.2%. But when they average it out with all of the other states, it's a 0.7% increase on the maximum, on the high end, and that's if they dramatically increase the overhead costs for these Medicaid and for these Medigap plans to process all of the different claims that come in. And that's what a lot of the Medigap plans do, is to process the payment, for the additional 20% in coinsurance. And so we're able to then go to state legislatures and say, here's the data. Here's what actually happens if you expand access. And that's really been helping us to engage policymakers, educate them on the issue, to talk about some of the day-to-day challenges that patients have. And that's why, the third action item is, we need your support. We'd love for you to get more involved. So if you're not already a member of Dialysis Patient Citizens, we hope you'll take this opportunity to join our organization at dialysispatients.org. You can also sign up to become a patient ambassador, which, we have over 1,000 who will participate in, whether it's fly-ins in Washington, D.C., go to their state capital, help speak as a representative on behalf of those patients who can't. But I think what's most critical and urgent right now is to continue the momentum that we're already building on the Jack Reynolds Memorial Medigap Expansion Act, or H.R. 1676. So if you haven't already contacted your congressman, congresswoman to co-sponsor this bill, urge you to do so today. There are links on our website that let you do that, but at the same time, you can always call the Capitol Switchboard and reach out as well. And we also can help get you connected if you contact our DC office too. So I hope that some of this was helpful to kind of run through all the different options. If you have private coverage, if you're thinking about switching over to Medicare, Medicare Advantage, some of the potential challenges you may see or may face, or if you've got Medicare and you're thinking about, should you consider switching to Medicare Advantage? And if you do, what are the short-term benefits and what are the challenges if you switch back to Medigap? Or if you don't have Medigap, I hope that you'll consider looking into, have the premiums come down? Are they now available? Have the laws changed? Does it give you the kind of peace of mind, the protection that you need to ensure that you get the care that's so critical to keeping you healthy? And so with that, I'd really like to open it up, for questions in the chat box. I know there's a lot of information that, I covered, and welcome you to go ahead and weigh in. And while you type questions, Nancy, I don't know if there's any, comments that you'd like to share, even about your own personal experiences with, why it's so important to know what kind of coverage you have.
Yeah, thanks, Hrant, and I'm glad that I have the opportunity to be on the line with you. I will share what happened with me at the time I was under 65, and at the time, Delaware had a lot of programs for dialysis patients, and they actually gave patients an insurance. Bank of America, it was called. It wasn't affiliated with the bank, and that was one of the ways I was able to get my transplant. Now I don't have to worry about being under 65 anymore, so I was able to get a supplemental insurance now through AARP, which is another option for patients. But a question that I do have, and this was great information, and I just hope a lot of people were on the line to get it. But if, a lot of patients are so busy dealing with the actual disease that insurance is not always something that they can pay attention to. They may not have the resources or anybody to talk to. The only resource they may have is the social worker in the dialysis center, and I know that that job is a very busy job, and sometimes it takes a while for the social worker to actually talk to you. So for a patient that needs to find out this information, find out what's best for them, what would you suggest that they do if they don't have access to a social worker?
Well, that's a good question, Nancy. I think, one of the requirements for Medicare, they call it the conditions for coverage, is that every facility, have a social worker. I absolutely, I think the demands on social workers, I saw, Joanne Smith typing Good afternoon. I know she also is a nurse manager and also can potentially help provide additional support or guidance and steer, those kinds of individuals, whether it's your social worker and maybe it's the nurse or facility administrator in your facility. I think there are additional resources that you should, talk to about your care. I think, it's one thing to go ahead and call up the numbers that you see on your screen and ask a navigator for additional support, but they don't necessarily know your entire medical history. They don't know what medications, what other specialists, who else you're seeing, and I think the social worker generally should be your go-to person, but at the same time, at this time of year, it's also a really busy time, and that's also, I think, a good example of self-advocacy, where patients should say, okay, I understand, but, can we make a time to talk before the end of the week? Can you help me with, comparing plans? Last year, DPC had created a tool that helped, try to compile plans in one place, because one of the challenging parts is, if you look at, if there are 14 different plans available, or let's say 45 different plans available, or you might be in a region that there are no Medicare Advantage plans available. That might not be an option. Well, at the same time, you still have to go to those websites to see, is my dialysis facility in the network? Is my nephrologist in the network? And that's a lot of websites for you to kind of go through individually. And I think the facilities also have a lot of those resources, and have gone through and done some of the research as well. And but they can also help you, even through the Medicare.gov website does have some additional information where you can start looking at what options may be out there. But even on the Medicare.gov website, you then have to follow up and go with each individual website and look at, some of those considerations. What, are the other out-of-pocket expenses that you may need to consider too. And I appreciate Joanne just made a comment that, so for Fresenius, they now have insurance coordinators in addition to the social worker, because as you heard, it's a pretty complex issue, figuring out which insurance is the best option for you, and going through all those different options. And so that's great that that they've created an additional position, added all these additional insurance coordinators. So if you don't know how to connect with them, ask your facility, and that's an additional really great resource that's available.
That's true. I just wanted to make a comment, then I'll address another person on the chat. Blessy Lopez Garcia thinks that's amazing that Fresenius has insurance coordinators, and I think that's pretty amazing too, because in Delaware, Fresenius is one of our major dialysis facilities, but the doctors come from an organization called Nephrology Associates. So together, since they have someone now that is an insurance coordinator, I mean, you can't get better than that, because as I said, the social workers sometimes have 2 and 3 facilities, and you may need that information right away. So by having an insurance coordinator, I think that's just really great. I just wanted to go to our own Kelly Goff, the DPC Western Region Advocacy Director, and she says, Hrant, thanks for a very informative presentation. She wants to know, can you briefly discuss how the enrollment period or periods for Medigap differs from Medicare Advantage and why that's important for Medicare eligible patients to know about?
Sure. So as far as the enrollment periods, generally, if you are going to enroll in a Medigap plan, the Medigap enrollment period, it kind of starts from the first 6 months of your eligibility. And so that's absolutely critical if you are switching from private coverage into Medicare, that's really the period that you want to look into getting a Medigap plan, because after that plan period, there are the ability of plans to go ahead and charge higher premiums. Patients may not think that they need an additional, additional coinsurance or cover those plans, and so there are many, almost half of the dialysis patients who are over 65 who actually went into kidney failure after enrolling in Medicare, and so if they chose not to enroll in Medigap when they signed up but enrolled later, or if, let's say, they went into kidney failure in February and they said, well, let's, during the December open enrollment period, let's sign up. Well, then unfortunately, then insurance companies have the ability to charge higher premiums for dialysis patients. And I think that's the main point that she kind of wanted me to bring out. I know that's one of the main, comments that was in a recent Washington Post article about some of the challenges with Medigap that patients just aren't aware of. Of course, there's annual open enrollment periods that we're in right now for both Medicare and Medigap, Medicare Advantage and Medigap that run through December 7th. But there's also another Medicare Advantage open enrollment period that continues on in January. So if you were already in Medicare Advantage and you wanted to change your plan in Medicare Advantage, there is another open enrollment period available. But I think generally most of the commercials, a lot of the advertising focuses on this current one because that's the time period when if you're in Medicare and you want to make the change to go to Medicare Advantage, then you need to look at that, now, through till December 7th. So, and I think the other thing, too, if you do choose to go to Medicare Advantage, there have been some protections that allow you to change back after the first year if you decide it's not right for you. I know some individuals have commented on they've done that because the plans may have changed after or the information wasn't accurate online, and I think that's why it's so important to talk to your social worker or, in Fresenius's case, insurance coordinators about, what plan might work best for you because, if you wait down the road, once again, they are able to do what's called rating and look at your health status and actually charge you higher premiums, which they are unable to do anymore in exchange coverage and most private coverage, but in Medigap, unfortunately, they are still able to do that. And there is more comprehensive legislation that, we've been discussing, which addresses some of these additional reforms that will allow for more ongoing open enrollment periods for Medigap, that will allow patients to switch more frequently, that may add an annual birthday rule, allow more options, but that was originally proposed for inclusion in one of the Build Back Better bills, but as it got pared back, was kind of taken out. And so I think there's a lot of momentum about trying to figure out what more can be done in general for Medicare eligible patients to help ensure that it continues to not just be accessible but affordable, and that those individuals who may miss out on enrollment periods aren't penalized, and especially if the premiums for the plans that they sign up with, if those premiums continue to increase down the road, that they're able to go and change to less expensive plans without potentially seeing additional increases in their premiums.
Hrant, this is such great information, and as I said, I'm sitting in for Dr. Kathy Nickham, but I always think about the people that do not have access to a computer or an iPhone. If there are any questions, and I don't know how many people are on the line, so I don't know if we can open the line or not, unmute the lines, but if they have further questions about this information that you have so gracefully presented, how can they go about doing that?
I believe, is it *6, or I'm sorry, #6 to unmute if people want to ask any questions.
Right,
and then, of course.
Okay, go ahead. I'm sorry.
And I was going to say, of course, in addition, I know most of the people who often end up participating in our webinars watch the recording. And so if you're watching the recording and you'd like, more information, you can contact our office in DC, 202-789-6931 is the main line number. And Rhonda Clark, our grassroots manager, can also help, steer you in the right direction. And or, if there are specific questions that we can answer, we are happy to go ahead and follow up with you as well. But I think, the main point is to go ahead and leverage the resources that you have available in your facility, whether it's your social worker, whether it's nurse, insurance coordinators, you name it. And so the phone number, Blessy, thanks for typing, it's 202-789-6931. That's the DPC main line. You can always go to, for those who are not, online, but at the same time, it's amazing now with technology, more than half the people who use our website are doing so using a handheld, using an iPhone, using a Droid, whatever, and so Google phone, you name it. And so it's also really easy, whether you're calling or if you want to go to our website, either at dialysispatients.org and send us a message, or at the Education Center website, at dpcedcenter.org website, to go ahead and get those questions, answered in a timely manner. And we're truly fortunate that we've got someone like Rhonda, who's one of our main point people, because she has just been a terrific advocate for patients in finding out the answers, even if she doesn't know it, if our staff doesn't know the answer, or in getting you connected with the folks who can provide additional help or support.
Great. Thanks again, Hrant. And before I let you do some final words, because I don't see anything else in the chat, I have to put a plug in for the DPC support group. I am Nancy Scott, the facilitator of the support group, and I just wanted to let you know we meet every second Tuesday from 3 to 4 via telephone. We do not use the computer at all. And we can also relay a lot of your questions and answers about support groups, transplants, any of that kind of information. So I invite all of you to join us the second Tuesday of every month from 3 to 4. And I'd like to thank DPC for letting me sit in for Kathy. And Hrant, I will turn it over to you for closing remarks.
I appreciate it, Nancy, and thank you for not only participating, your continued leadership. For those of you who don't know, the DPC Education Center was actually Nancy's brainchild when she was on the board of DPC. The thought that, if we're going to have even better advocates, that we need to further empower them, that if you know better, you do better. I've heard her say it numerous times. And, I think that's one of the reasons why I'm grateful to have been invited to speak about, insurance options, about Medigap, about, what may be available, but also our advocacy efforts. And I just wanted to do a real quick recap of the action items. So for those of you who don't know, make sure you do, find out about what type of insurance you currently have, and then, talk to your social worker. I'm going to have to add in there in the future your insurance coordinator about what options are available to you. And then I think the third, probably most importantly, if you want more options, we need your help. We want you to get involved. Join DPC if you're not already a member. Become a patient ambassador. Urge your representatives to support the Jack Reynolds Memorial Medigap Expansion Act. And so those are the action items that we asked for. And so in closing, I mainly wanted to thank you for attending, for your continued engagement, for everyone who's on this call now or who's going to be watching the recording of this webinar. And remind folks that there's our next webinar is going to be December 16th, not January. You can tell the year is wrapping up, but I guess not fast enough for me. So it's December 16th, and you can become a member of DPC and get more connected with the Education Center, by going to dialysispatients.org. Click on the Get Involved button, and then there's going to be a feedback form that's available to you too. We'd really love your feedback. I know this isn't the sexiest topic. Insurance isn't necessarily always, maybe one of the most impactful